Hi everyone, welcome to my channel, and today I'm going to be talking about objectification of the body in context of infertility and artificial reproductive technologies such as IVF. So body objectification in context of infertility and, for example, IVF, we can understand as a preoccupation with specifically woman's body. And how is this done? Is it through ongoing measurements and scans and checks, classification of woman's right reproductive age, as well the checks of the right woman's weight, which is referred normally within NHS or even private clinics as the right BMI. Understandably, to undergo any fertility treatments, we need some sort of data. But what is problematic about the body objectification is that the main preoccupation here is with the body, so with the scans and checks, and within the process of that, perhaps certain values of the person, their individuality, their concerns, anxiety might be actually lost in the process. So mainly the body is being approached, not the person as a whole. Sometimes also the body objectification is being referred within the literature as a silencing. When we look at the medicalized approach to, for example, IVF, we could assume that possibly as long the do not harm is fulfilled, there will be no ethical problems. However, the patients in the process of objectification, they might be denied the moral agency of the treatment, which I think becomes very problematic here. Because perhaps it leaves people possibly feeling vulnerable and maybe having lack of agency in what's going to happen during the treatment, or maybe as well having lack of the choice of what's going to happen during those treatments. And another problem perhaps with the body objectification, specifically when we think about the infertility, is that the body objectification is preoccupied with women, and that perhaps locates the problem in a woman. So all the scans, all the checks are predominantly done to woman's body. So she might be the right age, or she might not be. She might be the right weight, or she might not be. She might be eating the right food, or she might not be. So in a case when, for example, the fertility treatment fails, then there's a chance that perhaps woman, she might be blamed for the failed treatment. And it doesn't have to be done actually directly, someone saying to her, oh, it's your fault, but maybe even phrases like, so maybe next time we will try to eat more healthy, or maybe next time we will try to exercise more, or maybe you should have tried maybe losing weight, maybe that would help. So perhaps statements like that can really locate the problem within the woman and also put the blame on her. And possibly as well, what that does as well, the objectification, is just locates the responsibility within the woman, which feels like actually something really heavy. So on the top of everything else, there's also that huge responsibility for the treatment actually to work. And it seems like that responsibility predominantly is being put on women. We can also see what is happening in fertility clinics. So perhaps there are questions that are being asked to the female partner and also the male partner regarding their lifestyle. So there are questions regarding the drinking and smoking and exercise in general. But perhaps once the quality of the sperm is being checked, and if the quality is fine, then perhaps that's where the male partner is being left, and there's no concern about his lifestyle. But then it's the preoccupation, then it's being put on woman, on her lifestyle, what she does. Perhaps she's the one who's mainly responsible for the success of that treatment. And also perhaps what's happening in the fertility clinics is that most of the advice that is given during those treatments, they're actually given to the woman. So the advice, for example, which makes me actually really laugh, the advice given to women to relax, and obviously when that advice is given to them, it's just given, I believe, with the best intention that those doctors or nurses they have. But what that advice does as well, it's again positioning the problem in a woman. So for example, if the treatment fails, then there could be an assumption that perhaps she didn't relax enough, and maybe that's why the cycle failed. but and that's what as well can be seen on other devices. So for example, advice to eat more healthy, or maybe advice to lose weight. And again, when the treatment fails, then the preoccupation stays with the woman. So the advice will be given to her, so next time maybe you're gonna lose the weight, and maybe that's gonna help. So I do believe that the issues related to body objectifications are real, and I do believe that the people, they do suffer because of that, and because of that kind of medicalized, almost purely medicalized approach to fertility and IVF. And also I do believe that perhaps we need more conversation about issues like this in order to help people to become aware what's being said to them, what's being done to them, so that they can become an active agent in their fertility treatments. So yeah, if you like this kind of videos, if you're interested in fertility issues, artificial reproductive technologies issues, then please subscribe, like this video, and leave a comment so we can engage in conversation together.